I'm going to discuss dementia, and the number one point with dementia is that this is a preventable and reversible disease if you catch it early enough. So as you can see, I've got some notes I've taken here and I put up on the screen. Try to zoom in on this a little bit to make it a little bit easier for you to see. Oh, it's not going to let me do that, so let's just do this. All right, that should make it a little easier to read. First of all, dementia is preventable, like we said. The main cause of dementia is inflammation. We've heard a lot of different causes and blah, blah. Now that's basically your normal type of dementia. There's also multi-infarct dementia, which is from strokes, but we'll talk about that later. My main point I want to talk about is how the onset of dementia starts at age 30. Starts with moderate cognitive impairment. This is based on proven brain studies that measure brain speed done on an EEG. This is similar to your computer. Computer's running normally, that's great. Gets a virus, slows way down, that's dementia. Dementia is associated with memory loss, confusion, attention deficit, omissions, also jumping to conclusions. So what you see is a brain that you can't pay attention, so you miss stop signs, lose your keys, you're just not with it. And this is progressive. The term they use for this is MCI, moderate cognitive impairment. Starts at age 30, and it's a gradual decline. However, there are some things that can make it worse. Toxins, substance abuse, multiple things. So reversing MCI has a 4-pillar approach. I talked about that in the previous video. They call it the EDGE program, and it's also called the path approach. So we're going to break this down into our different systems. We have your endocrine system, your adrenal system, your thyroid system, and then your hormone system. So I'm going to talk about your endocrine system first, which is your adrenal gland, your thyroid gland, your hormones, your brain, which is your neurotransmitters. You basically have these biochemistry pathways that have a dramatic effect. So we're going to talk about going through this probably in the order of importance. Your adrenal gland, which is also called adrenal fatigue, can end up in adrenal failure, and you can actually die from that. This is very difficult to fix. There's a regimen through Dr. Wilson. He wrote a book on chronic fatigue. I'm sorry about that. Adrenal fatigue. And in his book, it's very interesting because he talks about all these different ways of fixing it. But my experience as a physician, I've just found out that it really has not been working, has not been effective clinically. So the latest thing we've learned is that by supporting testosterone with pellets, or probably other forms, but mostly we think pellets probably help the best, is that the testosterone can help the adrenal gland recover, because the adrenal gland, if you look at the pathway, will suck energy from your hormone pathway through testosterone, and that can be measured by DHEA. If your DHEA is low in the lab, then you know that your adrenal gland probably is consuming testosterone. There's a name for that. They call it the adrenal steal effect. Basically, that means the adrenal gland is stealing testosterone from your hormones. The next thing that's important is the thyroid. The thyroid is really responsible for the speed of your computer processor. If your energy is low, your energy is made in the thyroid. Your thyroid makes ATP. Now, the interesting thing is that when we treat hypothyroid, as physicians, we typically use Synthroid, which is really T4. T4 is an inactive, or what's called a prohormone. And the prohormone, they mean it's not a hormone yet, it has to get perverted. So in order to convert it into body, it needs an enzyme. And normally, if your body's working right, there's no problem. But there's a lot of things that can block the conversion of that: inflammation, toxins, sugar, stress. I mean, we could go on and on about what can block it. The important thing to know is that it can be blocked. So why give Synthroid or T4 when you can take T3 and not have to deal with that? So I think that's the point, is we need to point out that you can take a natural thyroid hormone, which is called Armothyroid. There's another company that makes called Naturethroid. I think there's another one too, but I don't have that at my fingertips right now. Now, the other issue is, as I documented down here, well, first I said the next question is, how fast do you want your computer to run? Less than average, average, or above average? I think my answer is I want my computer to run as fast as I can get it to go. I want my car to go as fast as I can go. I want fast, fast, fast. I'm American. I want everything now, and I want it fast. So I want my thyroid fast. Well, normal labs will show you that a normal thyroid a T3 runs anywhere from 2.1 to 4.4. And that's normal, but that's not optimal. We don't care what the bell curve is. We don't care whether somebody's low normal, normal, or high normal. We want to run this thing as fast as we can. We want high normal. We want our T3 at 4.4 or 4.5. So in order to do that, we need to supplement with Naturethroid or Armothyroid. And you start out half a grain twice a day for a month, and then gradually go up and monitor this until you get your T3 up to 4.5. The next thing is hormones. Hormones have been basically put down for really not any reason that I really understand, other than the fact that people don't understand what a hormone is. First thing we need to understand is that the biggest problem we've had is Premarin. The WHO study came out, freaked everybody out, made the news, got everybody scared. Premarin caused breast cancer, MI, strokes, and some other problems. So what is Premarin? Premarin is conjugated estrogen and progesterone. So I think when you talk about hormones and all the bad stuff, you need to look at that is a combination of conjugated estrogen and progesterone given together orally. That's where the problem is. Right now we have lots of data that shows that bioidentical hormones, testosterone, 17-beta estradiol, given in a pellet form or some other form that does not have the first pass effect going through the liver that you get through the oral absorption, is perfectly safe. Now, my big concern is we have these issues going on in this country, and yet we're supposed to be the greatest country in the world, the greatest healthcare system in the world. Meanwhile, our healthcare system is rated 22nd out of 23 countries that have been evaluated. That's terrible. So my goal in treating somebody is to improve your endocrine system, get your adrenal gland fixed, your thyroid get fixed, your hormones, and then adjust your neurotransmitters, basically in that order. If you have any questions, you can please put those in the YouTube. Any questions I may answer in the YouTube down at the bottom there, or I may do another video.